All right, so this is my Facebook Live number 2, and I'm glad that you can join me to have further discussion about how to better our lives. So let me just start you with a real life scenario. So I have a patient, she's about 75 or so, has obesity, hypertension, diabetes, and she's just been feeling sick of late. She just doesn't feel well, low energy, and she developed these weird rash on her skin. The problem is then, of course, her PCP sent her to see a dermatologist, gave her some cream. She didn't get better. Then she even got worse. She loses her hair, and she just doesn't feel well. Make a long story short, she actually seen a number of different specialists, including the one up in Stanford and then UCSF. And she still didn't feel well. And then one day I just saw her, and this is about 3-4 months ago. I just saw her, and then I found out the story. So then I asked her, well, how's her diabetes going? She said, well, it's okay. So well, what is okay? Well, my sugar running fasting about 120, 130 range, and my glucose testing. I said, well, do you check your sugar? I said, well, no, I don't check my sugar. I said, why not? I said, well, my doctor said that I'm fine. My A1C is 6.5. It's not that bad. So then at the same time, all that does is that it just tell me that, well, we just look at the way your health in a wrong way. What we see is that we see the typical scenario of a patient who actually tried to get better, who got somewhat sick. And what do we usually expect to see is go see your doctors, get more medication, more treatment, and you just don't get better. That's the problem. And I think many of you or your family members probably experience this. You take more and more medication and you just don't feel better. You struggle even more. And then of course, you can always blame it to old age, but I don't think so. I think the reason why it is the case is because we have a different frame of mind. Our frame of mind is that somehow as we get older, we unable to heal ourselves, and we actually expect doctors to perform miracles all the time, give you all of these miracle pill or supplements in order to improve yourself, to heal yourself. But if you look at slightly differently, I think you'll be able to live a much healthier lives and with a lot less medication. For example, when we grew up, what do you see? We able to have our growth hormone, able to grow our organs, heal ourselves, no problem. Why is it all of a sudden we turn 20, 30, 40, and 50s, and all of a sudden now we have to rely on so much medical intervention and not able to heal ourselves? That is the problem. And I think some of that is a frame of mind. We think that somehow we unable to heal ourselves. So what I'm trying to get at is, if we just look at slightly differently, if we actually keep ourselves healthy, so we have physically strong and healthy, and then mentally strong and healthy, and also spiritually strong and healthy, then I think your body is going to be in a much better shape. So that's why I'm having that discussion. Now go back to that patient that I talk about. So then the first thing I do with her is that, well, let's make sure you're not burning up all the time, because when you're burning up all the time, your body is constantly have to put out these fire, and your body is loaded up with toxin from both medication that was given to you and also to do the repair process. Well, no wonder you keep struggling. So that's the first thing that I do. Well, the fuel of life is carbohydrate. So we just have to have a much tighter control of her carbohydrate. So then I just have her do a simple checking of fasting glucose and check her 1 hour after meal, and that's it. And we get really aggressive in terms of educating her to make sure that her sugar is very tightly controlled. And then all of a sudden, she gets somewhat better. Now, that is not the only answer, because what happened is that throughout those time, she already took so much medication and already have all of these medical problems over the years. So the number one organs in your body that is unable to keep up with you is your liver. If your liver is being biggest filter in your body, and if it's unable to cleanse itself to help to purify your blood and your inner self, then it's almost impossible to get better. So then I have to get a little more aggressive with her to get both the liver detox and GI detox in order to cleanse herself out. And then she got even better than that. The point is that, again, just like I told many of my patients, the best doctor in the house is that you yourself. And so when you do these things and you pay attention, 2, 3, 4 weeks later, and you get 10, 15% better, well, you're on the right track. So continue to do on that, improve on that. Now, sometimes you might try certain thing and you don't get that much better after 2 to 3 weeks. Well, then maybe you just not getting the benefits that you're looking for. Then try something slightly different. But the point is that pay attention to what your body is telling you, because if your body is telling you that things are going well and you get better, well, then continue on that and listen to that body. So that's part number one, is to be try to fine-tune yourself to be physically strong. And then the next part is to make sure that you're mentally strong. We talked about that frame of mind earlier. Well, if your frame of mind is, I'm just helpless body here, and I need this and that doctors or healer to give me extra medication or supplement or shot or procedures, otherwise I will not be able to get better myself. Well, guess what? That's what you're going to get. However, if you look at your body as this amazing being that were born with its ability to heal itself, then all you have to do is to fine-tune, to nurture that body, so then that body will be able to be in the position to heal itself. And that's is going to change everything. And then the last part is being spiritually strong. Whatever the religion or belief that you have, I think is extremely important to pay attention to that, because sometimes there's so much unknown in life, and without that faith, a lot of us are very hesitant to take that leap of faith. And when you don't take that leap of faith, sometimes you just kind of stuck where you are. You know that you don't feel well, you know that you don't have energy, you know that you're not getting better with whatever the medical conditions that you have, but then you're afraid to take the leap of faith to try something slightly different, especially something that is not harmful, or the chance for it to be harmful to you extremely low, but you're just unwilling to do so. And I certainly come across those kind of patients sometimes. They come in and I have to say, sometimes they look at me as if I'm talking Greek or Russian, because it's just beyond comprehension for them. Now, it's okay. Now, sometimes some people are just not ready to be at that point. I think it's totally reasonable. The point is that you want to be able to have the options on the table. Some people might be ready and willing to try something different to kind of heal themselves and take less medication. Others might not. Now, the important thing I want all of you to understand is, whoever the specialist that you see, whoever the PCP that you see, I would like all of my patients to keep seeing all these doctors. So just because you try something new does not mean that you abandon your present treatment. I think that's extremely important to know. So all these doctors can help to make sure that you're on the right track and you're improving. Now, if you're on the right track and you nurture yourself and you're able to heal yourself from within, and you're able to reduce all of the inflammations and all of that symptom that come up to the surface, and you got a lot better, all of these doctors is going to have to say, wow, you're doing good. Whatever that you do, continue with that and don't have to see me as frequently. For example, that very same patient, her sugar became impeccable. Her A1C became, within the normal range. She was taking like 3 different medications for diabetes. Now take only 1, and her sugar is still impeccable. Well, guess what? She saw her PCP, and he said, well, whatever you do, you're doing good. Just keep doing that, because you are so much healthier. So then, instead of seeing him or her for every single month for treatment or additional medications, this lady all of a sudden only need to see that doctors for maybe once every 3 to 6 months. The point is, keep your appointment with these doctors, so then that way then you continue to get the best health care possible. So nurture yourself, nurture your soul, nurture your spirits. That way then you be able to have those 3 pillars of life to take you to the next level. The important thing is, look at from a slightly different perspective. You can get better, you can get healthier, but you need to aim for it. If you don't aim for it, you never get there. And I think that's important, not only for medicine, but I think that's for other goals in life as well. So I always tell people, the sky should be the limit. If people are not laughing at your ideas, whatever that is, then that means that your dream is not big enough. So just dream big. Even if you go halfway there, or even, 1/4 there, at least it's going to be much higher than not having such a high dreams and high goals to achieve in life. And I think that's extremely important. And of course, you want to do it safely. So that's sort of like my discussion. Now, the second part I think people haven't talked about, and I kind of did that in my posting on my Facebook, is the mental health issue, the psychological issue. So many of us have anxiety, depression, PTSD, and the list goes on. And the problem that we have is that we somehow in medicine seems to separate that out. We put that into a separate category. And so, someone come in who get anxiety, depression, and not doing well with her other medical problems, then all of a sudden we say, oh, well, we'll see a psychologist or psychiatrist, and they'll take care of that. Well, the problem that I have with that is that this is one body. This is one soul. We are interconnected. So if we just address that piece by piece, then the result is just not very comprehensive. So the way to do it is to look at the whole bodies together. And I certainly do this with my typical patient that struggle, whether they have struggle keeping the weight down or trying to lose weight, or struggle with other performance in life. I tell them that the important thing is not only that you make sure your physically being is well taken care of, but mentally. And I ask them a simple question. What is your number 1 and 2 stressor in life right now? And most people who actually stress out about something, they're able to come up with the answer very quickly. And then it's not about the stress itself. I think number 1 is about what to do with the stress. And I think that's extremely important that you understand that. For example, this one lady come in and she feels so stressed out because her son just on the wrong path and has, getting to hang out with the wrong crowd and all other stuff. And then she feels that she somehow would save him. And the answer is, sometimes it's hard. Sometimes people need to find their own way. She can be there, can be helpful, but sometimes you're not able to help. So then my advice for such a lady is that, well, guess what? You need to remind your son that you're always there. You will always love him no matter what. You will always lend the supporting hand, but he needs to want the love. He needs to want the help, because when he doesn't, whether she forces on him or trying to get him to do certain thing, it's going to be impossible. And all she does is going to just feel sad about it, feel helpless about it. So it's way better to be there, to show the love and support. And then all of a sudden, he's going to remember that. He might not be ready at that point in time, but when he is, he knows that he can always count on his mother to kind of help him to go through the hard time. And I think that's really the important thing. It goes along with the other posting that I did a little while back about not drinking the poison. So for example, someone show up in your front door today and knock on your door and say, well, I have this package of poison to deliver to you. And if you open it up, and it explodes right into your face, well, no wonder you have a problem. But if you know that it is a poison, well, then you go, no, thank you, goodbye, and that's it. So the point is that there's going to be people coming along in your life who has a toxic situation or might make you feel a certain way. The important thing isn't what they've done. The important thing is, what are you going to do about it? And if you know it is toxic, if you know it is poison, then what you do is you just stay away from that. Including close friends and family sometime, because I think the closer someone is to you, the tougher it is in terms of the feeling of betrayal or sadness. I think that's really important to understand that. So anyway, so once you actually look at the stressor in your life slightly differently, it's not about the stressor, it's about how to manage it well. Once you actually manage it well, then all of a sudden it's no longer be that big of a stress. You know how to let go. And a number of my patients, I make them write a big bold print, put it in their mirror at home, say, let it go, just like that movie Frozen. Because sometimes you have to let certain things go in life. Things that is beyond your control. And if it is beyond your control, there isn't much to be done. And time has an amazing way to come around. So I think it's really important to remind yourself that when the time comes. Anyway, so that's sort of like my thoughts in the whole process. And any one of you have any additional questions, feel free to kind of send it in through the Facebook, and then that way, then we'll be able to answer more specific questions for you. So first is, how do I decide it is better to medicate versus try other form of treatment plan? I think the number one thing is nothing. I mentioned this before. When you're in the midst of so much complications and medical conditions, that kind of thing, before you make any changes, just take a step backward, reevaluate the whole situation. Now, usually, most items in life usually started somewhere. Not somewhere or sometime. Could happen a year, 2 years, 5 years, 20 years ago. So the important thing is make sure you trace back in time, that person, trace back in time and find out what is starting the starting point, so then you can take care of that. Regardless of what the plan is, your job is to make incremental changes. For example, if you're not doing well with anxiety, for example, and then people give you more and more medications, and all you feel just being groggy all the time and taking meds nonstop, then instead of just stopping it all the time, you try to nurture your life some, and try to meditate some, and try to look at your life stressor some, and to manage it better, and then go down on the medication. But don't just kind of quit it altogether, because the problem is you don't want to put your body through a state of shock. So that's why. I think it's really important to remind yourself that. Now, of course, you have so many different kind of complicated issues. So if it is one of those scenarios, then find someone who's able to kind of sort everything out with you. But my bet is you most likely have the answer. So for example, if you have about 3 potential root cause that resulted these kind of conditions, then my recommendation is try one for 3-4 weeks to kind of solve that and see how it goes. If you get better, then continue. If you don't get better, try the second solution to address the second issue. And then if not, then go to the third one. The point is, pay attention. You want to try one thing at a time, because when you have one variables and you pay attention, you'll be able to know what works or what doesn't work. When you have multiple variables, then it's almost impossible to address that. Any additional questions, issue, make sure you send in and let us know. The second question is, what is my thought about integrative health? I think the problem of life sometimes is that we kind of put a lot of labels on that. Integrative health, I think, means different things for different people. In my mind, integrative health is basically look at your body as one unit. Just like I mentioned earlier, so you look at your physical health, you look at your mental health, you look at your spiritual health, and then you'll be able to put all of that pieces, the puzzles together. Now, when you look at it from that perspective, I think it's extremely helpful, because all of your organs are interconnected. So therefore, if you have a stressor going on with your life, and then the stress hormone actually make your sugar go a lot higher, then all of a sudden your diabetes start to get out of control, and all of a sudden you just feel sick. You don't have a lot of energy, and all of that becomes a bigger problem because when your stress hormone is increased, then your body wants to increase the amount of sugar in your system, and that causes you sometimes to kind of overindulge with all these extra eating ice cream or whatever the treat of choice is. So the things to do is to put all of that informations together and then be able to evaluate that. Now, sometimes people ask me the question, well, what's the bare minimum I need to do to kind of see what's going on? I think if there's a minimum things that I recommend, and I do this myself, is to basically reduce this amount of inflammatory process. Because I think a lot of the problem we have in our modern life is that there's too much inflammation. For example, why do you have hypertension? Well, you can have a lot of inflammation in your blood vessels, and then that causes hardening of your blood vessels, and your blood pressure go higher. Now, why do you have asthma? You have a lot of inflammation on your airway, and then now it narrows down. You can't breathe very well. Why do you have cancer? You have a lot of inflammation in the end organs, and your body actually trying to repair it. But the inflammation get overwhelming over time, and then the corrective action becomes uncontrollable. That's what cancer is, uncontrollable growth. So I think it's really important to kind of pay attention to that. So the bare minimum for today's talk, for example, is, well, reduce the amount of carbohydrate intake. And that's really simple. I tell everyone this, I say it multiple times in the day, so it come out really natural. Drink only water, black coffee, or tea. That's it. Water, black coffee, or tea. Why? Because you're not going to accidentally drink extra carbohydrate. For example, if you put a whole bunch of creamers in your coffee, well, that's not going to be helpful because all of a sudden you get too much of carbohydrate in your system. If you drink a glass of juice, well, that might be equivalent to having 4 oranges in there, where you'd be lucky to eat 1 oranges or 2 oranges in one setting. So just drink that. Now all the other stuff, I'm not telling you not to drink those, like you want to enjoy yourself, have some juice sometime, some milk sometime, a glass of wine sometime, and then do that, but treat that like an ice cream. So don't do that every day, but give your treat sometime at the right place at the right time. So nothing has to be forbidden, but I think it's important to be moderate about it. Number 2, your liver, we talked about. Your liver get clogged up a lot over the years because of toxin you come across, environmental exposure. Even when people lose 40, 50 pounds, for example, what happened to those material that used to be in the 50 pound that you just lost? They now circle inside your body and they clog up the liver. And the analogy I use is that you might be the best dishwasher in the world. You wash your dishes perfectly clean, except there's pieces of food that clogs up the drain. So you look down the sink, there's still a puddle in there. So your job is to unclog that drain first. And the same thing that goes with your liver. So what do? Your liver? You want to detox your liver in order to make sure that your liver continues to function. Now, there's 2 ways to detox the liver. One is, of course, you hear about me mention about, artichoke tea, make your own, detox kind of tea. In addition, you want to give your liver a break. If your liver is constantly working days and nights all the time, it's really hard for it to be detoxed because it's constantly working. So you want to sort of like hit a reset button on your liver to give it a break. So therefore, I think it'd be extremely helpful for a lot of you to go finish your dinner at your dinner time, 7, 8 o'clock or so, and then go all the way to don't eat until 11 o'clock or 12 o'clock the next day. So you have 2 meals a day, you have lunch and dinner. What that does is that you give your liver a break during that time. You don't put any extra carbohydrate in your system. You don't put extra fat in your system. So therefore your body is able to kind of cleanse itself out and then rest up. So when it starts working again, it's going to be a lot more effective. And then it's going to start that healing process. And then the third part is then what do you do with your the rest of the time? Well, just have healthy diet. What is healthy diet? Healthy diet is having a lot of green vegetable, including tomatoes and carrots, and then have some healthy protein, whether a plant-based protein or meat-based protein, but those healthy stuff, and of course a whole bunch of different nuts that would be helpful as well, and that would be sufficient. So then all of a sudden the carbohydrate stuff is going to be the little extra on top. So that won't have to be the main food that you ingest. So then you minimize the chances for you to overeat. Anyway, so the next question is, what is the best way to control overeating when dealing with stress? Again, the question is why? Why are you overeating? And the answer is you get stressed out. So your cortisol level is increased. Your body wants to increase the amount of sugar or carbohydrate in your system, so you start to eating more. So the best way to deal with that is, assuming that you don't have any other underlying psychological issue, then the best thing to do is to have a routine. The beauty about routine, just like when you try to work today or go somewhere, you even remember what happened to the green light and the red light, and if you drive safely or not, just kind of do automatically. That's what routine is. So when you have a routine or your diet routine, then all of a sudden it minimizes the chances for these kind of overeating scenario. So for example, if you already do drink only water, black coffee or tea, so whether you stress out, you don't stress out, you still drink water, black coffee and tea. And if you already do 7 to 11, 7 p.m. to 11 a.m. no food, well guess what? When you stress or not, you do the same thing. So therefore, it minimizes chances for you to overeat at that point. Now the second part is also helpful, is that you wanted to do something to distract yourself as well, because if you're just sitting at home, stressed out, right next to the refrigerator, you keep opening up, well, it's kind of hard to overcome that sometime. So the things to do is, when you found yourself in that situation, I highly recommend to do something that's a little distracting, so that you don't have to think about it. We live here in Central Coast, beautiful coastline, and I asked many of my patients, when's the last time they go to the beach? And most of them say, well, can't remember. That's how bad it is. I made it the point, I go to the beach 2, 3, 4 times a week. I know it seems a little excessive, but it clears your mind. So when you get stressed out, instead of just sitting there and do nothing or look on social media or news, which can be depressing, all you do is go take a walk. Could be a hike, could be a walk at the beach, could be just driving around in along the beautiful beach line or the hills and all of that area. The point is, you want to distract yourself, and I think that would be extremely helpful. And then the second question, how do you make up for it? See, the problem isn't the overeating or gaining some of the weight and that kind of thing. People, I think, just get stuck in that situation because it becomes a vicious circle. For example, if you get stressed, you eat some extra, you gain a pound or 2. Now you feel even guilty about that. Now you get even more stressed, and then you eat even more. Well, that's terrible. So no stress. Don't worry about it. Once you have your game plan in place, you can manage your stress. So for example, if you already do 7 to 11, water, black coffee or tea, and then you have to eat a little extra because you have a party, or you get stressed out, you eat an extra 2 cups of ice cream the previous night or something like that, well then you ask yourself, what do I do to make up for it? What do I do to kind of undo that? The beauty is that all the extra weight that you just gained previous night is like new snow in the mountain, and those new snow can melt away very quickly. They are very different from the fat that's just sitting around for a long time like a sheet of ice in the mountain. So as a result of that, all you have to do is the next day, instead of going 7 to 11, well, you just skip lunch altogether, so just go straight to dinner time. Or just have a very light lunch. Have something like, a few carrot stick or cucumber or celery, and have a few, sliced cheese or something like that. The point is, you want to lighten up the load on the next day meal. So what that does is that it gives your liver an extra, 2, 3, 4, 5 hours to cleanse out the extra weight that you gained the previous night. So then all of a sudden, you have ways to kind of make up for the deeds that was done the previous night, and then you don't have to feel guilty because the sense of guilt itself is going to be stressful. Anyway, so if I eat overall really healthy, can I enjoy some creamer? Absolutely. You can enjoy anything you like, just like I mentioned. So the question is when. So for example, you like your creamer, you want to put those yummy creamer in there, then that's great. Then have it during the eating time. So you still protect your liver, you still hit that reset button on your liver, so your liver gets to cleanse itself out. So then your cup of coffee would be at noontime with your creamer that you like, for example. Now, how do you ease the blow? That's a big question. Well, if you do that and you don't have any weight issue and you don't have another problem and you don't have a lot of inflammation, there's nothing to worry about. But if, for example, you have concern about gaining some extra weight or unable to lose the weight that you were hoping for, then the solution is actually pretty simple. Start your meal with the green stuff. The green stuff has a lot of fibers in there, so by the time you eat the green stuff, it lines your stomach and your intestine. So by the time you you drink that coffee with the creamers on there, then it lessens the amount of absorption of carbohydrate and fat into your system. So all of that is going to be a very simple way to manage that. Just don't start your 11 o'clock meal with a cup of coffee loaded with creamers, because then 100% of all of that is going to get sucked right into your liver, and that is going to just filling it up. So I had the green stuff before that, and I think that will be a very simple way to address that. Going back to the next part is that some of you are incredibly healthy already, so then you might not need to be super low carb or anything. So the fruit is a big thing, and I think one issue we forget is that fruit, when you're little, strawberry little tiny and they sour, you don't even want to eat them, and now they're really big, twice or 3 times as big, and then very sweet. So the important thing is make sure you minimize the amount of fruit. So when you talk about low carb, you want to stay away from fruit. So if you want to introduce some fruit because you don't have concern or weight and you just want to be healthy, then the number one fruits I like to go for is any berries. So blackberry, blueberries, raspberry. They have low glycemic index and has a lot of antioxidant in there, so it keeps you healthy. Now the other stuff, you can eat them too. Again, eat them after you eat the green stuff. Next question is there anything else other than melatonin to try and sleep when dealing with insomnia? See, insomnia is a funny situation. And this is a typical example that we hear. How often you hear people have different kind of ailments and they say, well, what do you take? What do you, medication or supplement? Well, sometimes it might be neither. Sure, melatonin and all that stuff is important, but what you really should ask yourself is why? Why is this happening? Why am I up all night? And some of the typical example is just the fact that your mind might be running so fast all the time, it never gets a chance to slow down. Just like that liver that we talked about, if you're revving it up all the time, it's just working all the time. So you need to quiet your mind down. So if you on the internet playing games or do social media and then you go to sleep, well, guess what? Your mind's still thinking about all of those topics, but it's really hard to set it down. So your mind needs some time to kind of cool down. Like when you turn on one of these old-fashioned heater, and then when you turn it off, it doesn't turn off completely. The fan's still running, kind of cool it down, and then it turns itself off. So that's what you need to do with your mind. Now, sometimes, well, I got no time. I have to go to sleep right now. Sometimes a little bit of, if you have extra carbohydrate around because of, food intake or the fact that you're just a little bit too hyper, then you need to expend that energy. So I have patients that have to do an extra 10, 20 push-up at night or pull-up or, burpee and all that stuff. Why? Because they're going to burn up that extra energy. And then all of a sudden you can calm your mind down some more. Now, there's sometimes a number of people have a much bigger issue. There might be some psychological issue that happens, that they went through in their lives. Could be PTSD, could be other kind of issue. So if you have those kind of issues, it's extremely important to become cognizant of it. The first treatment is always become aware what the problem is, because are you treating the insomnia, the symptom, that's not going to be long lasting. You need to treat the actual cause of the problem. And then all of a sudden, your mind is going to calm down. Now, one thing I think I mentioned the last Facebook Live that I highly recommend those actually kind of can't go to sleep. Sometimes you woke up in the middle of the night, 2, 3 o'clock, usually 3, and you just can't go back to sleep. Instead of being frustrated, I highly recommend you don't be. Whatever that you have issues and problem in your life, like you can't go to sleep or you can't solve certain kind of issues and problem, ask yourself that question. The beauty is at that point in time, about 3 o'clock in the morning, your mind is wide open. Connect to the entire the world and the universe, the collective us. And the beauty is that the answer will come to you. So all you have to do is ask the question at the right place at the right time, and then see what comes to your mind. Now the trick is that whatever that comes to your mind at that point, as ridiculous of a solution it might sound, try it out, see how it works. The second problem is that sometimes you wake up in the morning, you forgot that great idea that came to your mind at that point. So then make sure you kind of make a little note for yourself so you won't forget. But that would be better use of your time instead of just kind of twist and turn around and just feel tired all the time. So that's important. Whatever it is, try whatever the solution that you think might be helpful for 2-3 weeks and pay attention. Your body will tell you if something works or something doesn't work. If it doesn't work, move on. After 2-3 weeks, try the next trick. Try the next potential solution. Because we are different, so there's a different solution for different individuals. So the things to do is to try it out and then find the best solution for yourself. And I think that's really important. This is the same question. Can insomnia be treated with medicine? Of course, insomnia can be treated with medicine, but how, the way to fix your sleep, just like I mentioned earlier, the way to fix your sleep is to find out the cause of the problem. And again, you have to go back in time and really find out what started the whole thing. Could be that, you just be a stressed out person, you get too much energy, your brain hadn't kind of wind down yet at that point in time. So whatever that is, you need to kind of find out. All right, so next, how do you explain to the family members that only believe in medicine and you want to try some other approach? I think that's always the hard part. And I think it's the product of modern medicine. Product of modern medicine is, hey, you grew up, you get to a certain point, you're unable to fix yourself anymore. Now you expect all the doctors to do all these medications and procedures to fix you. And it's not going well. A lot of the people, the short-term fix I think is great. Modern medicine is great to treat infections, broken bone, things that dislocate, for example. But modern medicine is not good in terms of treating chronic situation because that is a function of your body. And I think the important thing is to have a heart-to-heart talk with them and just remind that person one thing. So, when you grew up, your body is able to grow organs, literally increase the size, increase the height of your body, and repair itself. Why is it all of a sudden you turn 20 or 25 and all of a sudden you expect your body's unable to do that? Sometimes a little bit of questions instead of telling your family members about that is going to go a long way. The issue is that sometimes people take a lot longer before they actually have an answer or they come to their senses. So don't be frustrated. Your job is to deliver the message, and then their job is to accept it whenever they're ready, and sometimes they're not ready. I think that's the most important secret in life is that you need to remind yourself is that people need to want the change, want the help. If people come in and don't want any change, don't want any help, well then you shouldn't help them because they're just not ready at that point. Second question, is it okay to drink green juice only for 24 hours? I'm not sure what that means. I assume that people just do juicing and drink that. Absolutely you can do that. It has a lot of fibers and has a lot of antioxidant, assuming that you put the right content in there. So let me just tell you the next part. So you know how I talk about 7 to 11. So 7 p.m. to 11 a.m. no food, right? So then the question is, well, how do you get to the next level? What if you've done all of that already? So I want to get even healthier, better. So you look at people, in big study in Japan, for example, they see these people in the 80s and 90s, and they're still very functional, and they have a sharp mind, and they're very mobile. Well, what is it that they do right? So one of the Japanese researchers actually did all of that study, and one of the answer is autophagy. Autophagy or autophagia is basically restoring your body, clean out the old stuff, and then growing healthy tissue. Or in my simplistic way to look at it is, it's like setting the self-cleaning button in your body. So then that way, then you can kind of renew yourself. So how do you get to that point? It's pretty simple. So that takes me to the next analogy. In a poor country, you look at the trash pile, they don't have a lot of trash. They recycle every single thing, the bottle, the container, the plastic wrap, and all of that stuff. In a developed country like ours, we have a lot of trash. And guess what? Our body got the same problem. If you're feeding your body all the time, your body is not going to be going around and try to recycle every single piece of DNA that is usable. So then you have too much debris and trash in our system. So the way to do that is to restrict the resources in your body, and then your body is forced to recycle a lot of these. The beauty with the recycling process is that you're going to take in the stuff that are usable, and you can discard the debris. So you're literally cleansing yourself out. So what do? Really simple. So instead of having that 2 meals a day we talk about, maybe a couple times a week, you feel healthy, you're doing good, you might even be busy with work, then you just go straight to 1 meal a day. So just have dinner, nice substantive dinner. That way then you'll be able to give your body a little extra chance to cleanse itself out. So by the time you get to that point, you're going to do really well. Next question. When you prescribe medicine such as antidepressant, is it okay to take it as needed, or does it sometimes build up in the effects? Yeah, any medication that you see all the time, eventually your body is going to build some tolerance to it. But more importantly, a lot of these strong mental health kind of medication has a lot of byproducts. The byproduct, which is the leftover, the debris that we talked about, kind of floating around in your body and can clog up your liver. That becomes a problem. So then you start to have these side effects. So even if your body do not build a tolerance for it, it still becomes an issue. So my recommendation is for any medication for that matter, take the least amount of that your body needs, and then give your body a chance to heal itself. So that way it's going to be a lot more natural. But I do not want you to do it by yourself. Just be honest with your doctor. Say, hey, I really don't want to take this much medication. How about can I take half the dose and try something else? Reduce the amount of inflammatory process in my body. And then that way, then I can see how it goes. And then if I can take even less than that, to the point of nothing, even better. But the point is incremental changes. Don't make any drastic changes, because when you do, next thing you know, your body is going to react violently. And then it becomes an issue, because then no one knows exactly what went wrong. So when those kind of situations happen, you ended up getting all sorts of new sets of medication, and then your body continues to spin out of control. So the things to do is incremental changes. Next question is basically, what do I do to speed up my metabolic rate? That's actually a very good question. The question is, do you really need to speed up your metabolic rate? I assume that you want to speed up your metabolic rate so that you can lose weight faster and you look fabulous faster. But I don't think you need to. Because what happened is that first, you need to make sure that your diet is healthy, so then that way then you're not going to put on that extra weight on there and extra toxin in there. See, the problem is that even if your metabolic rate overnight double, and if your liver is all clogged up, game's over. You can't do anything because your body's unable to pull the fat and the toxin out of your body. So the important thing is, again, look at your body as a whole. Changing one thing is going to be helpful. And now, assuming that you already have a healthy diet, you already detox your liver, you already detox your GI system, and you just want to rev up the engine a little bit, the best way to do that is to build up more muscle. Muscle is the big machine in your body. So when you actually increase your muscle, then your metabolic rate will increase. Now there's another way. Some of you kind of mentioned to, I mentioned to you before, but some people might not be so thrilled. It's about cold therapy. So when your body exposed to cold, what does that do? You have to speed up circulation to keep yourself warm, right? So that by itself is going to increase your metabolic rate as well. But many of us are so used to the comfort of, the warmth in our body, crank up the heater, the thermostat, wear all these extra jacket when it's cold. Well, then your body won't have a chance to mobilize extra blood flow, mobilize to burn up the extra calories. So it's okay to have a little cold therapy. So what is cold therapy? Well, that's another topic all by itself. But, in a nutshell, you expose yourself to cold at a certain period of time, and that will be extremely helpful, not only to expend extra energy, but also mobilize your lymphatic drainage. And that lymphatic drainage, I think, is extremely important in terms of improve your defense system, your ability to fight off, viruses and things like that. Next question. I read the article that advised people not to exercise near bedtime because your heart rate goes up and it's hard to relax. Maybe yoga, but intense exercise seems, how would you be able to do that? I guess the answer is it depends on how much energy you have in your body. So sure, if you're a regular standard person and you go out there and you do all these intense exercise, you might have some of that issue. But guess what? If you already have so much energy in that body, because you know how like you see these little kids, they have sugar high, and if they get sugar high and then you tell them just to go to sleep, they're not going to be able to go to sleep. They still have sugar high. So the only way to get these sugar high kids calm down, including adults, is to burn up that extra calorie. Sure, of course, they might be a little huffing, puffing a little bit, but then when they settle down, they're going to feel more exhausted because they got no more extra carbohydrate floating around. So that's why. Yoga, I think, is reasonable, but again, all of that is a function of how much of the stress hormone you have, how much of the carbohydrate intake you had that day. So that's why it's a little confusing. But again, who get the right answer? You do. You're the best doctor in the house. So if you unable to sleep and you do a little extra exercise to kind of tire yourself out a little bit, or you do a little extra yoga and get yourself a little more mindful and calm on your mind, and whatever works, I think you should do that. Try each one of these for about 3 weeks or so you can really see the effects. Next question. I have hypothyroidism. I noticed that the older I'm getting, the harder it is to lose weight. Is that more of my thyroid problem, or is that really making it so difficult? The answer is both. Both the fact that your thyroid might not be functioning very well. Now the nice thing about thyroid function is that it's easily treatable. So you just have to measure your the thyroid stimulating hormone, the free T3 and the free T4, and check the functionality of your thyroid. But in addition to that, you need to pay attention to what else is happening with you. And having, cleansing your body out, reduce the amount of carbohydrate is going to transform yourself to be a healthy person. Now the other issue is that a lot of time, many of us are walking around with like vitamin D and vitamin B12 deficient. And so when you deficient in those two, especially, you just don't have a lot of energy. So then it's hard to tell someone like that to go out and exercise because they got no energy to exercise with. Now the beauty is once you go through the transformation and you lose some weight and you have your fat being burned because you do 7 to 11 and water, black coffee or tea, the fat itself, the byproduct of that, the ketone body, has a lot higher energy than regular carbohydrate because fat is more energy dense. So that by itself is going to give you more energy, so you feel more motivated. The bottom line is that it's almost an impossibility if you're already 40, 50, 60 pounds over your regular weight, and then we expect you to go out and do all of these exercise and everything else. So my recommendation for all of those patients are slim down first. Lose the weight, because once you lose the weight, the beauty is you automatically get more energy. And for those patients, I just tell them that, hey, what is it you enjoy doing for activity? Could be walking, could be hiking, could be swimming, could be playing basketball or soccer. Whatever that you enjoy, do more of it. Why? Because it's a more enjoyable activity. Don't do that just because you have to. Because when you have to go to the gym or you have to do extra push-up or whatever, and then it's just not fun. You do that because you enjoy doing that. So then all of a sudden you can take it from there. But definitely slim down first. What are some effective ways to maintain my weight during the holiday season? How to eat mindfully during the holiday season? The answer is, don't worry about it. I know it sounds kind of dumb, but if you actually have the built-in mechanism to deal with that, there's no issue. For example, I have patients like, well, we have Thanksgiving and Christmas coming up and enjoy, hanging out with my family and eat more. The question is, how do you make up for it? The question isn't feeling guilty the whole time because I eat an extra piece of pie or drink an extra glass of wine or something like that. How do you make up for it? So for example, pretty simple. If you have a Thanksgiving dinner and you eat a little extra, assuming that you gain an extra 2 pounds or 3 pounds, the next day, well, just skip lunch altogether, go straight to dinner. And on top of that, have a light dinner. Then all of a sudden, your liver all of a sudden has an extra 3, 4, 5, 6 extra hours to digest and burn off those carbohydrates that just filled up in your liver. Now remember, the fat get formed when your liver overfill itself with carbohydrate. So when it gets too much carbohydrate, it has to convert it in form of fat, right? Storage. So if you give your body a chance to kind of cleanse out all of that carbohydrate in your liver, then all of a sudden your body is going to do the reverse, which is, wow, I got no more energy. I need to maintain this body. What do? Well, I'm going to use some of my reserve. So if I just put up that extra 1 or 2 pounds the previous day, you can just peel it right off. And it's very easy to come off because it's brand new stuff that we just put on. So it comes up so much quicker than the kind of fat that's sitting around for 5 or 10 years. So then all of a sudden, you don't have that extra stressor, because I think the stress of feeling guilty, of not eating certain thing is actually very damaging. Why do you have acupuncture in your practice? Have you personally get benefit from alternative medicine, and does it help your patient? Well, I consider myself very lucky. I grew up in that environment. As a little kid, my grandma used to, take me to, have, cupping, and I don't know if you're familiar with coining. So it's kind of similar to cupping, and it's go along with the acupuncture and all that stuff. And so I was immersed in that culture when I grew up, so I'm very familiar with that. And I think that's the important thing, is that when you look at these other treatment modality, the question is, does it help you? That's all it matters. You should be the best doctor in the house. So if you have, for example, terrible backache and joint pain and headache or something like that, and then you already see a neurologist, you already take this and that medication, kind of help a little bit, but it haven't solved your problem, and you need something different, well, give the other one a try. The point is that, try that new treatment modality, whatever that is, for 2-3 weeks and pay attention. It might or might not work for you. But if you never try, how do you know it's not going to be helpful for you? I think that's extremely important to realize that. Now, sometimes people can get kind of technical. So what if you have placebo effects? Well, just assume that you have placebo effects and you got better. Well, is that going to be good? I think it's great. Well, you get better. That's all that matters, isn't it? So as long as your body's telling you that you're getting better, and you truly get better, and you're on the right track to get better, that's all that matters. So let your body be the judge of that. You just have to pay attention. Try it enough length of time so that you can make a definitive kind of conclusion. And in my opinion, about 3 weeks or 4 weeks would be sufficient. Your job, though, is don't commit that act of insanity. What is it? Trying the same thing, expect different results. So for example, if you try the same medication, you try the same everything, and you get sicker, weaker, fatter, and unhealthy, and feeling guilty all the time. Any piece of food that you put in your mouth is, is feeling guilty. Well, then maybe try something slightly differently, because life is miserable if all you do is popping a whole bunch of pill all the time, and then anything that you touch to eat, you feel guilty. What good is life when that's what you have for, right? So you want to be able to live your life freely, healthily, and even if you overdose sometime, you know exactly what to do to make up for that. So therefore, you won't be feeling guilty. And I think Thanksgiving and Christmas are the big occasion. A lot of people have all of these kind of concern. Now, the makeup period of time should be immediate. Don't say, well, I'm going to have my New Year resolution to lose an extra 5 pounds or whatever. Well, it doesn't work because we all know New Year resolution doesn't work really well. So the important thing is make sure you have a measurable, concrete game plan to treat with whatever the concern that you have previous night. Any additional question? So the next thing is that, well, what else do you do with this Thanksgiving? Now, as you know, coronavirus is getting worse. We get more and more cases, more and more people affected. And so what I strongly recommend all of you to do is please, please don't get big family Thanksgiving get together, because all that does is just a breeding ground for more coronavirus, and it's going to be higher. You think it is high now, or if people start to have these big Thanksgiving get together, it's going to be even higher than that. So my recommendations for all of you is, as sad as it is, just stay within your immediate unit. Don't even bother to travel to different places. See, the minute you travel outside of your home, you lose control. You cannot ensure that whatever the new environment that you're in is going to be safe. So therefore, just stay home. We happen to be very lucky to live in a beautiful part of the country. So take a little road trip to Big Sur or to Monterey or Seaside or Santa Cruz, and that's it. Do a day trip and just simple. My thing is going to be extremely important. It's going to take all of us to be cognizant to keep ourselves healthy. So resist the temptation to get big gathering, because the minute you pull the mask down and eat or drink something and talking, well, guess what? The droplets can be flying everywhere. Now the problem is sometimes you have healthy people. Some of that droplet might be hanging onto your body, your clothes. You don't even pay attention. You might even be tested negative. But the problem is the minute you come close to some people that have medical conditions or elders, then they might get infected, and that is the problem. And we kept a lot of our elders nice and safe in Monterey County. Let's keep it that way, because I think that is the right things to do. So again, please resist that temptation, and then we go from there. The other part I think is that family get together can get tricky, because a lot of you might understand this so well. You have certain people that you get along well, or other people that you don't get along well, or some kind of expectation about you. So whenever you have these kind of scenario, you need to remind yourself one thing: happiness comes from within. You cannot expect anybody to make you happy. You are the only one to be able to make you happy. So just because some cousin or aunts and uncle, congratulate you about whatever the things that you do well, shouldn't be the reason why you should feel happy. So you should be happy because you've done the right things in life. You make big, significant contribution to society and the world around you, and then you can feel happy because of your own achievement, whatever that is. And we different individual, we have different life purposes. So it's important to understand that and to achieve your life purpose instead of expecting some external person or sources or material to keep you happy. Once you practice that mantra, I think you're going to do really well. So at this point, I just want to thank you for your attention and share this 1 hour with me. And I really hope that we continue with this journey together so that we can all having a healthy lives, less medication, less procedure. The less you see me as patient, the better. I told all of my patients that, because that means that you're getting healthier. And especially would like to thank my two producers, Diane Han and Grace Khieu. They always done an amazing job to make this easy, because I just show up and stand in front of the camera and just talk, and that's it. But they done all the work. So again, thank you to their contribution and their preparation. And have a good night.